po, Dr. Nina.
Magandang hapon po. One of the vaccine candidates has finally neared its arrival in our country, and we welcome that development. Given the fact that there's no available other brand as of now, and no confirmed date of delivery of the other vaccines, having this particular donation at this point in time is welcome, especially for our healthcare workers who have been saving lives and attending to our health during the entire time of the pandemic. Thank you.
Thank you po. Dr. Edsel.
Hello, Laura. Sorry, I'm mobile. I think I just concur with what everyone has said. This is the first batch of vaccines that's arriving, and we've always said that we'll take the first vaccine that can save lives. And now with the FDA clarifying that this is not a prohibition, but it's up to the doctors themselves and the healthcare workers to decide if they want to protect themselves earlier or later, then I think it's completely appropriate that we be given the first choice, whether we are going to take this vaccine that's already available or if we want to wait. But at the same time, based on the data, this vaccine looks like it will save lives. And so I think that it is but right that we offer it to the people who have been on the front lines, who have been saving lives. And if they feel this is not the right vaccine for them, then we are not going to penalize them. They are still first in line for either the Pfizer or the Astra. But as for myself, as a healthcare worker who sees COVID patients, I am willing to take this vaccine over.
Thank you po. Dr. Ana.
Ang pagdating nitong Sinovac vaccine sa ating bansa is something that we need to allocate very rationally. Kasi nga, alam natin na ang bakuna is a very scarce resource. And para maabot natin yung ating goal, na to minimize or to decrease the number of people who get sick and die, we have to be able to deploy this resource very rationally. So after much deliberation and review of the data, na pagkasunduan ng NITAG at ng TAG na sulit pa rin na ito ay i-alok sa ating mga healthcare workers at mabigyan sila ng pagkakataon, based on their own understanding of the information that we will provide them, kung ito ba ay gusto nilang tanggapin or hindi. So it's a very special situation kasi unang-una, hindi naman tayo wala naman tayong capacity sa ngayon na magkaroon ng napakaraming vaccine doses at sapat para sa lahat. So, yung tina-target talaga nating population na siyang pinakamataas ang risk, ang inuuna natin at binibigyan natin sila ng pagkakataon na sila rin na mag-participate sa decision-making process.
Thank you po, Dr. Ana. Dr. Isa?
Good afternoon to everyone, and thank you, Laura. I concur with the statements of my colleagues here. The vaccines, unfortunately, is a scarce resource at this time, so it's a scarce supply. And considering the circumstances that our country is in, wherein the first vaccine that we have now is really Sinovac. So the same considerations in evaluating was used. So the efficacy, the safety, and then rational allocation of the vaccine. And then NITAG has come up already with a prioritization framework, which is anchored on the aim to reduce morbidity and mortality among the highest risk, no? And that is the healthcare workers. So having said that, the evidence for Sinovac came from unpublished trials, but this has now been reviewed, no, by different panels. And the consideration first is it is a safe vaccine. No? There is no safety issue as far as this vaccine is concerned. I would even say that considering that it's an inactivated vaccine without the allergenic components, it can be safer, no? Because it does not have the components such as the polysorbate that can cause allergy. The efficacy, on the other hand, so this is where we now give to the healthcare workers the ability, the value judgment on how they will weigh, how much weight they will give to the efficacy rates. No, it's 50% for mild, but 80 to 100% for moderate and severe. So we now give the healthcare workers the chance to decide based on their assessment of their risk and whether they would allow themselves to get vaccinated with this vaccine. So again, it's safe, it's efficacious, it's this is what we have for now, and so that's the circumstance where we are in, and so that is what we're telling our healthcare workers, no, in helping them decide on whether to be vaccinated or not. But we are offering them this vaccine.
Thank you, Dr. Raisa. And then lastly, I'll have Dr. John Wong.
Laura, may I show some slides?
Go ahead po, Dr. Wong.
Can you see my slides?
Yes po.
Okay, so I just wanted to show some stats about the performance of the Sinovac vaccine. So this is based on data that was shared by FDA. So the vaccine efficacy is 59% overall among healthy, normal risk, non-elderly population. It's 86%, so it's quite good. Among health workers, it's about 50%. Better among younger health workers, less than 60 years old, it's 50.6%. But not so good among older ones, it's only 36%. In terms of severity of disease, overall efficacy is about 50.3%. But among those that have more severe disease or moderate disease, about 78%, and for severe disease, 100%. So if you just look at mild cases, the efficacy is 44%, but among moderate and severe cases, the efficacy is higher, 72 and 100%. So if we had this vaccine last year, in NCR, we could have averted 42 health worker deaths, and prevented 3,300 cases, and preserve our health system. So, in summary, people always ask me, which is the best vaccine, and my answer is always that the best vaccine is the vaccine that you can get. So this is the vaccine that we have now, and it's the best vaccine for our health workers now. Thank you.
Thank you so much, Dr. Wong. So it's been very clear that the recommendations of our NIATAG members is first and foremost maintain our prioritization framework, which means we will offer Sinovac to our healthcare workers. And Dr. Raisa mentioned value judgment, so we're going to engage them and show them all the necessary information so that our healthcare workers will be able to make the informed choices for themselves. With that, I'll open the floor to we also have Dr. Dorotan in the call. Doc Eddie, would you like to say something? He is also a member of our NIATAG. Sige po. Balikan lang po natin si Dr. Eddie maya-maya. I guess yung question po, unahin ko na lang po sa efficacy rate, no? Yung sinasabi po ng FDA na mababang efficacy rate na 50.4%, yung healthcare workers po ba kasama doon sa 100% efficacy protection rate po sa moderate to severe? I'll ask Dr. Rosette.
Yes, can we ask our experts on this as they were able to review completely the documents that were given to us? Maybe we can ask first our NITAG because that was part of their decision, and then we can have our TAG experts and Dr. John.
Dr. Minette Rosario, please.
Hello. The data for the 100% vaccine efficacy for moderate and severe. Actually, 100% for severe, and I think around 80% for the moderate. And then the healthcare workers are included in, because for the trial that was for the trial information that was shared, this was for the ones in Brazil. This is the data that was available. So the answer to that question is yes, healthcare workers were included.
Okay, any more of our experts po who'd like to add to clarify yung 100% efficacy rate versus the 50.4%? Dr. Edsel?
Yes, actually that data is from the Brazil trial, which was made up of 100% healthcare workers. So 100% efficacy against severe disease, 78% against mild death.
Salamat po. So on to our next question. So tuloy po ang rollout ng healthcare workers na makakakuha ng Sinovac, including those in PGH, or we will still await for the necessary po bang antayin ng HTAC recommendation? Dr. Renina?
Thank you, Laura. As per information from the legal service of DOH, because these are donations and they're not yet procurement using government funds, for now, for this particular set of Sinovac donations, we do not yet require an HTA assessment. However, if we are going to procure the vaccines, any vaccines for that matter, then we will need a health technology assessment. Thank you.
Thank you po, that's very clear. So for those donated, which is the doses coming in po, no need for HTAC. But if we're going to, for when we will procure, kakailanganin po ng HTAC. On a more operational concern, there's a clarification. If a healthcare worker declines Sinovac, will he still be in a priority for the next available vaccines? Dr. Conti?
Yes, definitely. Kasi itong vaccine naman natin, hindi yan pinagpipilitan. Even when we roll out ito, talagang may consent kasi it's up to the person to receive or not. Okay. Let's say, for example, dinecline niya itong vaccine na to, then eligible pa rin naman siya dun sa susunod na tranche ng vaccine na darating. I hope that was a short answer. Over.
Thank you so much po. Next question po is, clarify ko po ano yung priority list ngayon. Kasi di ba bawal po sa senior citizen. Sino po ang top 3 priority groups for this? Dr. Ana, would you like to answer po?
Yes, Laura. So, tandaan natin itong donation, very limited quantities, no? Ang understanding natin is 600,000 doses. So, we're only talking about 300,000 people. And then we also know that we have as our A1 priority list, the healthcare workers, which number about 1.2 million if I'm not mistaken. So doon pa lang, kung maganda ang uptake natin, medyo mauubusan na nga talaga tayo. But having said that, the NITAG also discussed contingency. So kung sakasakalit bababa yan, syempre isiskip na natin yung A2 kasi hindi pwede ang elderly. So bababa ito down the line for the group na pwedeng sakupin ng EUA, which is 18 to 59 clinically healthy adults. So malamang maaring makababa ito dun sa essential workers kung may matitira pa po.
Thank you po, Dr. Ana. Yusek Vergere, this question po might be best answered po, no? And we will flash the specific provisions po ng FDA because they are asking the role of NITAG and TAG. There are questions from netizens saying how does this somehow overturn the non-recommendation of FDA for the use of these vaccines to our healthcare workers. And so to clarify that, we'll flash a specific, the salient provisions po of the FDA. So Yusek Reset can explain to us that it was not actually, it was not, hindi po siya, hindi recommended, no?
Okay, go ahead,
Yusek.
Laura. Would you be explaining this EUA?
Yes, Yusek. So part of the recommendation actually, or yung salient provisions po ng EUA, if you're going to see it, it says that it should only be given to those who are clinically healthy individuals ages 18 to 59. We would like to clarify that in no part, that was not part of the FDA EUA po na sinabing bawal siya or contraindicated siya sa ating healthcare workers. It was just wanting to tell our national government that when they are allocating these limited resources, to consider that for mild cases, it has a low efficacy rate of 50.4%. So we're clarifying na hindi po contradicting yung NITAG recommendations with the EUA provisions. And in fact, the NITAG recommendations po completely supports the FDA provision of allowing it only for those ages 18 to 59. And that's precisely why Dr. Ana said that we will be skipping the elderly po muna for this.
Laura, if I may add.
Yes po, Yusek.
Yes, so just to clarify, no, so nung naglabas po ng EUA ang Food and Drug Administration, mismong kay Yusek Eric Domingo naman lumabas. Sabi niya, this is recommendatory. This is not to say that it's going to be part of the EUA as a contraindication to this vaccine. Flinag lang ng FDA na sinabi niya, base sa mga pag-aaral nila, nakita nila dun sa mga dokumento na yung efficacy was 50% against mild disease. Pero sinasabi nga natin na binibigay natin ngayon sa healthcare workers the decision if they would want to accept or not. So ito pong nakita ng ating NITAG and TAG members dito po sa pag-aaral na maaari naman natin ibigay sa ating mga healthcare workers because yung ating objective of reducing morbidity and mortality ma-achieve pa rin natin because Sinovac can be able to prevent moderate to severe disease by as much as 100% and even hospitalizations by as much as 100%. So isa po yan sa naging point for deciding ang ating mga NITAG kung bakit po natin binigyan ng rekomendasyon na ganito. Let us all remember FDA has this recommendatory function to the Department of Health. NITAG also has recommendatory functions to the DOH. So ito pong Secretary of Health natin together with IATF, based on all of these recommendations, pinag-uusapan po nila kung ano po yung best na gagawin at mas magiging efficient at saka effective ang gobyerno dito po sa mga sinasagawa natin programa. Laura?
Thank you po. Dr. Conky.
Nakikita ko lang kasi, no, gusto ko lang ipaliwanag na kasi yung 600 doses is doses. Para kasing, ay, ang dami-dami, ganun. Hindi ganun karami. Tatandaan po, 2 doses para sa isang tao. So actually, good for 300,000 people. Itong darating na donation na to. Thank you.
Salamat po. Next question po is on data. So I'll direct this to Dr. Wong. So are the phase 3 trials result of Sinovac submitted to FDA peer reviewed? The PISMID keeps a track of vaccines with phase 3 clinical trials, but it has yet to include Sinovac, citing they haven't received or seen any document which was submitted by Sinovac. Sir?
Yeah, Laura. So the documents submitted by Sinovac to FDA have not been published in a peer-reviewed medical journal yet, no? And that's a EU practice naman, no? They usually release it or publish it after it has been seen by the FDA, no? Because some of those are company trade secrets. So for example, for the Pfizer vaccine, they submitted their request for approval to US FDA first, and then subsequently published in a peer-reviewed journal. So with Sinovac, the trials are in the middle. No? So they published interim analysis, and this is what they submitted to the FDA for approval. So they haven't been published, and that's the reason, no? Because it's still with the FDA.
Thank you po, Dr. Wong. To Dr. Nina, just so maklarify po yung mga media partners natin. The question is, does NITAG's recommendation supersede that of FDA? And does it mean that future vaccine recommendations from FDA may not be final? Dr. Nina?
Okay, thank you for the question, Laura. NITAG and TAG respects the authority and supports the initiatives of the Food and Drug Administration. And all of the talks that I have given on vaccine confidence, I always say that kung tama ang proseso at aprobado ng FDA, tiwala po ang taong bayan kasi po ay dumaan po ito sa matinding pagsusuri po. Hindi po natin papabayaan na mabigyan tayo ng bakuna na hindi na angkop sa pangangailangan at hindi makakabuti po sa kalusugan ng mamamayang Pilipino, lalong-lalo na po sa ating healthcare workers who are first in the priority. Thank you po.
Thank you po. Maybe I'll address this question po to any of our TAG members, maybe kay Dr. Ana. Yung tanong po nila is, since medical frontliners won't lose priority, how will you convince healthcare workers to take the Sinovac jab now instead of waiting for a vaccine that's more efficacious for them?
That's a very important question, Laura. I think it recognizes the context of our situation right now. Ang problema kasi natin, alam mo, asang-asa tayo na darating na yung iba, di ba? I mean, to talk about PGH na lang, for example, because I'm also part of the community, there was a lot of, how should I say this, anticipation na parating na yung bakuna, tapos syempre nasabi naman sa amin na mukhang Pfizer yung darating. And I have to say, nabuhayan talaga ng loob ang mga tao kasi finally andyan na yung bakuna, may darating. Alam naman natin na maganda ang data na nanggaling doon sa trials or sa interim analysis ng data ng Pfizer. Pero ang problema is medyo nagkakaroon talaga ng issues about whether these vaccines will come and when they will come in. So recognizing that and also recognizing the fact na nandito naman ito, minabuti na ng grupo ng TAG at ng NITAG na bigyan ng pagkakataon ng mga tao na sila ang pumili. Hindi natin to ipinipilit sa kanila. This is being given as an option kasi may mga tao na feeling nila sa bawat araw na ipinapasok nila sa ospital, tinataya nila buhay nila eh. Tapos sasabihin natin, ito hindi pwede sa inyo when in fact may data naman na pwedeng magsabing, pwedeng gamitin. So now it becomes a matter of choice after being informed na option ninyo to, nasa sa inyo kung gusto ninyong tanggapin. Kung hindi, walang pilitan, hindi ka mahuhuli, hindi ka mawawala sa pila. Basta binibigyan ka ng opportunity to take this up if you want it.
Thank you, Dr. Ana. Before I ask Dr. Edsel or Dr. Isa, para lang din po matapos na is, how about healthcare workers sa ibang hospital na nag-aantay sa Pfizer? Will you allow them to wait for Pfizer vaccine before Sinovac? Dr. Edsel?
Yes, that holds true for all the healthcare workers, not just the COVID hospitals. The prioritization framework holds that we work our way down from the COVID hospitals to the government hospitals. And because of the unique situation na sinabi nga ng FDA, maybe other vaccines might be efficacious. That is why we are allowing the healthcare workers because they deserve to be first in line and they deserve to make the decision if there is a vaccine there already, if they feel it's not the best, but as Dr. Wong said, you know, it is the vaccine that is there that will protect you now, then we always want to give them that choice because
Thank you, Dr. Edsel. Dr. Isa, would you like to add something on that?
Yeah, I just like to say that the prioritization list will be followed in the allocation of the vaccines. Just as we have maintained the healthcare workers as the priority, then there is also a list that has been vetted, made by the as far as hospitals that will be receiving the vaccines. And in this case, as we have mentioned, we are giving the healthcare worker a choice, no, on whether they would want to get this vaccine or not. And so, and remember that the supply is only 600,000 doses as of this time. So we will maximize that, no, and distribute to all those who are willing to be vaccinated.
Thank you so much po. Given that this is only recommendatory in nature, does it have to be approved pa po ba by the IATF, then by the President? Yusek, maybe you could give us yung proseso lang.
Yes, the process would always be that the NITAG will be recommending to the Secretary of Health and to the IATF. And then just this morning, we presented to IATF and we got the approval already. So this would also be presented to the President. But right now, we can see that all of the members have approved of these NITAG recommendations already.
For Dr. Wong, yung tanong po nila is considering daw hindi peer-reviewed yung data or hindi published, sapat po ba yung data to support the recommendations of NITAG?
Yes. First of all, FDA itself does not require clinical trials to be peer-reviewed or published kasi they do their own analysis. Similarly, for NITAG, TAG, and TAG, that's why we also requested for access to the data, so that we could also review it ourselves. So it's gone through at least 2 or 3 levels of review by experts. Thank you.
Thank you so much po. Yusek, yung tanong po nila dito, considering na i-maintain po natin yung prioritization framework natin, once the rollout starts, would that mean that healthcare workers in the 34 prioritized hospitals will receive Sinovac po?
Well, everything is being finalized at this current time. Pinag-uusapan pa ho uli kung paano natin ibibigay at sino-sino mga ospital ang makakasama dito. So sa ngayon, ang maibibigay pa lang nating impormasyon sa inyo na makaka-resibo ng una healthcare workers, and based on our sub-prioritization list, mga ospital po, mga healthcare workers sa ospital ang mabibigyan. Now, kung sino-sino pong ospital, ano-anong ospital, ang mabibigay pa lang impormasyon ngayon, basta yung mga designated or dedicated hospitals for COVID will be prioritized, at yung pahong ibang mga makakasama ibibigay natin sa mga darating na araw.
Klaro po. Yung operational na question po is, do we have syringes for the vaccines that are arriving on Sunday? Dead space syringe po ba ito, or is it part of the donation, separate cost? Didiretso po ba sa ospital lang bakuna from the airport? If not, dadaan ba to sa logistics partner? Yusek?
Yes, so itong darating sa atin ng mga donasyon would be a per dose vial. So 1 dose per vial siya. So kapag ganito, according to our experts, hindi natin kailangan ng specialized syringe for this, yung mga dead space syringe. Yung mga ordinaryong syringes lang po yan at meron ho tayong adequate stock sa Department of Health nito. As to the storage, the distribution, and the deliveries of these supplies, magbibigay po tayo ng information in the coming days. But right now, fina-finalize pa ho lahat yan at pinag-uusapan.
Thank you po. Healthcare workers want access to data. Are there plans to publish the data you have so they can analyze it for themselves and in turn feel confident in their decision to take the vaccine or not? I guess, Yusek, we might want to talk about our town hall meetings with the hospitals.
Yes, I think what would be most critical in this question would be the sharing of the information to the healthcare workers who are requesting for this. Unang-una po, ito pong binigay sa ating dokumento was really confined for our experts, for them to use to recommend to the Department of Health and IATF. Kasi po, embargoed documents ito. Ito po yung mga dokumento na may mga agreements po tayo for confidentiality. So we just signed a memorandum of undertaking para lang po ma-access ng ating mga experts which guided them into deciding dito po sa ginawang desisyon ng NITAG. As to sharing this information to the others, I think we will be sharing details but not the documents through these town hall meetings that we will be doing. We start tomorrow. We start with the big hospitals tomorrow, and then in the coming days, sunod-sunod na po yan yung iba't ibang ospital natin dito po sa ating bansa para makapagbigay tayo ng information and of course to give them all of these evidences to give them that power to determine if they will accept the vaccine or they will not get the vaccine now and just be waiting for the other types of vaccines. Baka po yung iba nating experts, Laura, would like to also give their additional inputs to this.
Yes po, I'll begin with Dr. Nina Carendang po.
Pakiulit nga yung tanong, Laura.
Paano po, I guess yung question is paano din natin mako-convince yung healthcare workers po, considering embargoed yung data na meron po tayo?
Okay. Actually, tali po ang aming mga kamay at aming mga bibig sa pag-share ng actual data set. But what can be shared would be highlights from the analysis which has been done by my colleagues. This will be shared during town halls, which we will have with the healthcare workers in the various hospitals. So, ang lagi ko po sinasabi ay kung tama ang proseso, tama din po ang pagsiyasat ng mga eksperto, dapat ho siguro tayo din ibigyan ho natin ng pagtiwala din po yung pag-iimbestiga, pag-aaral sa mga datos po na yun. Wala po sa aming control yung actual data kasi yun po ay pinagpaalam pa dun sa manufacturer ng FDA. Lahat mo na aming queries dun sa manufacturer ay through the FDA. Sila lang din po ang pwede magsabi kung ano pang i-release po nila. Thank you.
Thank you po. Dr. Hongki, dahil nakita niyo po yung data, ano pong masasabi ninyo?
Sa abot ng siyensya, nothing is perfect. O kahit na yung nagplano ka ng pinaka-perfect na research o wala naman makakapagbigay sa iyo ng talagang 100% talaga na kumpiyansa, no? But as far as I'm concerned, it will save the lives of our health workers. So, kumpiyansa ako doon sa data. Thank you.
Salamat po. Dr. Minette?
Laura, idagdag ko lang na yung sa information or yung data dun sa clinical trials, everyone wants to see it. As a society, yung Philippine Society for Microbiology and Infectious Diseases or PSMID, nakikita naman na meron kaming tracker na nilalabas dun sa social media to update lang yung citizens regarding yung information sa bakuna. So, ang magagawa namin sa society for the citizens would be to actually request permission para mabigyan tayo ng or mapayagan tayo na ilabas yung mga impormasyon na gusto nilang makita regarding the trial at ilalagay namin dun sa tracker.
Thank you so much po. May isa lang pong question na non-vaccine related. I'll ask the tag lang po, no? So any comment po on DOT and Mayor Isko Moreno's proposal to open Intramuros to families without age restriction once a week, lalo po't bawal pa rin ang below 15 years of age sa labas ng bahay? Won't this expose children and senior citizens to greater risks of COVID-19? Thank you po. Dr. Ana.
Yun kasing proposal ni Mayor Isko, of course, there's merit to it. No? Siyempre, kailangan din naman mabigyan ng opportunity ang mga taong lumabas, also for their mental health. Pero I think we're restricted by the regulations that are still in place coming from the IATF. So hanggang ngayon, di pa rin naman ina-amend yung age restrictions that are in place. And we still need to abide by those rules, no? So in the meantime, it's also still worth considering, gawa nga ng nakita naman natin na medyo dumadami pa rin ang mga kaso, meron pa ring issue ng variants. So kaya nga din hindi muna tayo nagbaba from GCQ to MGCQ. So those are the factors that are in play right now, and hopefully we will be able to control transmission more adequately in the soonest possible time as the vaccines come along, so that we can expand, no, the range of people who are allowed to go out.
Thank you, Dr. Ana. Dr. Isa, would you like to add po sa sinabi ni Dr. Ana?
I have nothing to add, Laura.
Thanks po. Doc Edsel?
Nothing further, Laura.
Thank you. I guess yung question ni Michael Flores po, last few questions na po tayo. How critical is it for healthcare workers to accept the Sinovac jab to raise the general public's acceptance of taking COVID vaccines, given our current challenges of convincing some members of our population to be vaccinated? Dr. Renina?
We always look up to our healthcare workers for good examples, no, of how to take better care of ourselves. So if our healthcare workers are reluctant to accept vaccination, then that also sends a signal to the general public. So we'd like to offer this opportunity for healthcare workers, if they're willing to do so, to have themselves vaccinated with Sinovac. If they don't feel that this is the best vaccine for them, given their risk-benefit analysis for themselves, then they can still wait for the other brands of vaccines. But unfortunately, we don't know yet what is the current status of the negotiations and what is the actual delivery date of the vaccines. So that's the tricky part that you have to look. You might not like the current brand available, but if you think that your risk is high at this point in time because of patient care duties or exposure in the community, then you also have to think about how much worth is it for you to actually have the Sinovac vaccine, because we don't know yet as to when the next vaccines of whatever brand are coming to the country. Thank you.
Thank you, Dr. Nina. I think that's all the questions we can accommodate. All the questions on yung operations po, no, how many vaccinators are already trained, we'll just send it over Viber. So I'll give time for our experts to give their final message as it relates to the recommendation to prioritize still the healthcare workers to receive Sinovac. I'll begin with Dr. John Wong.
Thank you, Laura. So the reason that health workers are prioritized is that these are people who, since the start of the pandemic, they have put their lives on the line, no, on a daily basis, no, to face down this pandemic and to save lives, no. So as in terms of fairness, no, this is the most important obligation of society to to people who have taken care of the population during this pandemic. Thank you.
Thank you po. Dr. Minette Rosario.
5 minutes.
Yeah. May framework na sinundan for prioritization. The recommendation po ng NITAG ay based on that and from the data or information na naging available po sa amin sa mga clinical trial.
Thank you po. Dr. Nina Carandang.
We'd like to emphasize again that vaccination with the incoming Sinovac donation is voluntary, and we'd like to give the right of first refusal after informed choice to our healthcare workers because they deserve it. Can we actually ask our media partners to help us watch out for people who want to jump the line? We want to preserve the line of priority for our healthcare workers because they deserve it. If they want to give up their slot for this particular Sinovac vaccine and wait for the next vaccine to arrive in the country, that is their personal decision, and it is not mandatory for them to accept this particular Sinovac vaccine. This is a donation, and we hope that we will be able to procure our own set of other vaccines from the other brands soon. As my tokayo Konki Kison also said, there's no 100% vaccine, which is perfect, nor is there 100% process of vaccine deployment, which is perfect. We'd like to ask the help of all of our partners in media to help us spread the news of the availability of possible vaccination for healthcare workers who might be interested to avail of the protection that they can have. If they are hesitant to accept this vaccine, then they can wait for the next available vaccine available. But we don't know when that will be. Thank you.
Salamat po. Dr. Konki.
Because of this pandemic, globally, we have come to realize that the healthcare workers are our national treasures. So dapat alagaan, dapat protektahan. So itong vaccine na to ay pagkakataon upang pakita natin na kaya natin at dapat natin protektahan ang health workers. Thank you.
Dr. Ana.
The recommendations coming from the NITAG for these donated vaccines are really meant to provide a rational framework for allocation. Gusto natin na ang mga bakunang to ay makarating dun sa grupong pinakamataas ang risk for sickness and possibly death kung hindi pa rin sila maprotektahan. That's been our basis ever since nung sinisimulan nating ayusin itong allocation ng mga paparating na bakuna. Now, dahil nga hindi tayo sigurado kung may darating pang iba at kung kailan darating, ang gusto lang naman nating gawin para dito sa darating na donation is to make sure na yung grupong yun, which we of course consider to be the healthcare workers, will be given the opportunity to make a choice. So wala pong pinipilit, ito po ay inaalok, at kung sino po ang gustong tumanggap, nasa sa kanila po yung desisyon. Now, ang isa pang sinisiguro natin is when or if they decide that this is not for them, then they will not lose their place in line. And so we continue to preserve the framework within which we made these decisions from the start kasi gusto nga natin maayos ang proseso ng pagde-deploy at pagiging available ng mga bakunang paparating. Yun lang. Thank you.
Thank you po. Dr. Isa.
Okay. Thank you, Laura. So I'd just like to say that the principles of science and equity were applied in the decisions of the NITAG. in offering this vaccine to our healthcare workers. As we've said, there's no 100% protection, there's no 100% or perfect vaccine. In our deliberations, what we looked at is to ensure that safety, the vaccine is safe, and that has been borne out by the review of the trials. There are variations in efficacy, and that is why we give the healthcare workers the chance to decide for themselves. So it's not mandatory. We give them the right of refusal, as mentioned, because we recognize that they are the ones at highest risk, and we deem it important that they be given the option. That's why they are really priority one, no, in the framework. And we would like to retain that framework regardless, as unfortunately, the vaccines are a scarce supply, no, as I mentioned. So we offer them this vaccine, and the evidence has been reviewed diligently by several panels. Again, it's safe vaccine. You can decide for yourself now whether you would want to take this vaccine that is being offered as a priority for our healthcare workers. And I just also like to mention that in this control of the pandemic, vaccine is one of the interventions, no, that is much awaited, no, to help us control the pandemic. But again, we still have to remember that we still have to practice the personal protective measures together with the vaccine, because there is really no 100% protection. Okay, so it's part of our bundle of protection, no, against COVID-19.
And finally, Dr. Edsel.
Maraming salamat, Laura. Nagpapasalamat po ako sa ating NITAG na inuna po talaga ang ating healthcare workers. Katulad ko po, isang taon na po tayo dito na hirap at malapit na po talagang dumating itong vaccine for people who have been waiting and risking their lives. This is so important. I don't know who doesn't want it, but for me, I want it. And I thank the NITAG for giving it to us, giving us the choice. Ilang tulog na lang po, excited na po tayo. Maraming salamat, NITAG. Maraming salamat, DOH. Maraming salamat po.
Maraming salamat po sa inyong lahat. Very clear po yung ating NITAG, ang ating TAG, at si Dr. John Wong sa kanilang rekomendasyon na ito ay base sa kanilang pag-aaral at mismong siyensya. Yusek Vergere, meron po kayong mensahe?
Yes, thank you very much, Laura. Unang-una, gusto nating pasalamatan ang ating mga nakasamang eksperto dito sa panayam na ito. We'd like to thank NITAG, our TAG experts, Dr. John Wong, sa patuloy po na pag-guide sa amin at pagsama. No? We'd like to thank the media partners also. We just like to request, nakikiusap po kami sa ating media partners na sana tuloy-tuloy po tayo magtulungan para makapagbigay po tayo ng tamang impormasyon sa ating mga kababayan. Alam po natin na ang kumpiyansa sa bakuna ay napaka-importante. Napaka-importante po na paniwalaan ng ating mga kababayan ang importansya at saka itong quality at saka safety nitong mga bakunang parating dito sa ating bansa para po tayo ay magkaroon nitong tinatawag nating kasiguruhan ng pagtigil na ng sitwasyon na ito. Kailangan po nating maipagbigay alam sa ating mga kababayan ang importansya kung bakit ang healthcare workers po natin ang ating inuuna. Sila po, for the longest time, from the start of this response and the pandemic, sila na po yung humarap dito po sa sakit na ito. Inalagaan po lahat ng nagkasakit. At marami rin po sa ating mga healthcare workers ang namatay, nagkasakit dahil sa COVID-19. And rightfully, because of these principles na ating ina-adhere at base na rin sa rekomendasyon ng WHO, ang priority po natin talaga sa pagbabakuna ay ang mga vulnerable. And healthcare workers would be foremost dito po sa vulnerability na ito. Kaya po napagdesisyonan ng NITAG na ito po ay ibigay natin sa healthcare workers. Ngayon, dun po sa usapin na ang Food and Drug Administration nga ay nakapagrekomenda na bawal, hindi po niya sinabing bawal. Hindi rin niya po sinabing contraindicated. Ang sabi po niya, fina-flag niya po ang Philippine government dahil nakita dun sa mga pag-evaluate nila, mababa na laban against mild disease. But when you try to look at the whole spectrum at yung kabuuan ng dokumento, makikita po natin dyan 100% protection for severe disease, from hospitalization, 70+% protection from moderate disease. And that alone, no, ay isa pong napaka-critical na impormasyon na kailangan nating ipamahagi sa ating mga kababayan. At bukod dyan, gusto ko lang hong ipaliwanag sa inyo, paghiwalayin po natin ang usapin ng efficacy versus safety. Wala pong pinag-uusapan ngayon dito sa bakunang ito na ito ay hindi ligtas. Lahat po ng lumalabas na trials, pinapakita this is a very safe vaccine. Yun pong sa efficacy, ito po ay binigyan natin ng karapatan ng ating mga recipients who are our healthcare workers to have that value judgment para mamili kung gusto po nilang tanggapin ito o gusto nilang mag-antay pa ng iba pang klaseng bakuna. So dito po sa lahat ng ating pinag-usapan sa ngayon, sana po ay makatulong namin po kayo na makapagparating ng tamang information. The confidence in vaccines is very critical already. Sabi nga ng ating mga eksperto, ito na po tayo, this is real. And this is the actual reality at challenge natin ngayon. Parating siya, sana po tanggapin ng ating mga kababayan, especially our healthcare workers, because ang objective po ng ating buong gobyerno ay para maprotektahan lang po lahat ng vulnerable, and of course, priority would be our healthcare workers. So maraming salamat po ulit sa inyo. Maraming salamat sa ating experts. Thank you very much, Laura.
Maraming salamat po sa inyong lahat at magkita-kita po tayo muli sa susunod nating media forum. Good afternoon po.